Amanda Edstrom. Breast cancer accounts for 25% of all diagnosed cancer in the United States of America, states Victoria Waldorf, Vice President of Research and Community Health for the Susan B. Komen Foundation. Everyone in this room knows someone who was diagnosed with breast cancer at a young age, and whose life was greatly affected by that abrupt diagnosis. Insurance companies should begin to cover the cost of mammograms for women under 40 years of age. First, I will explain how insurance companies covering the cost of mammograms, or how cancer affects women and should not be taken lightly at any stage. Then, I will explain how insurance companies covering the cost of mammograms would greatly improve patient outcomes. So let me tell you more about cancer and how it affects young women. Young people are not being insured for the cost of mammograms. Insurance companies today cover the cost of mammograms for women 40 years of age and older. This is a huge problem when it comes to our fight against breast cancer. It is also a huge age range where women are not taking the proper precautions to find breast cancer at its earliest stages. This problem exists because insurance companies have decided that the cost outweighs the benefit. In Breast Cancer in Young Women, published on November 10, 2015 by Dr. Jennifer Robinson, a specialist in oncology, 7% of all women diagnosed with breast cancer are younger than 40 years of age. But insurance companies have decided that that 7% is not worth the cost, but they should be worth the cost. This is a lack of coverage for all women, but specifically women deemed high risk to develop breast cancer. In Breast Cancer Risk Factors Genetics, Marissa C. Weiss, a distinguished doctor, says that between 5 and 10% of all diagnosed cancer is considered to be hereditary. In the Mayo Clinic breast cancer book written by Dr. Lindsay Hartman and Dr. Charles L. Laprinzi, published in 2012, heredity factors are categorized into two categories: tumor suppressor genes and oncogenes. If there is an error in tumor suppressor genes, cell growth is allowed to run out of control. Errors in BRCA1 and BRCA2 result in a predisposition to develop breast cancer. Oncogenes, if damaged, also allow cell growth to run out of control without regulation. Errors in HER2 and EGFR are associated with breast cancer. Out of every 100,000 women, 123 will be diagnosed with breast cancer, states Victoria Waldorf, Vice President of Research and Community Health for the Susan B. Komen Foundation, and those women deserve the best health care and the highest chance of survival. Many women are going undiagnosed and allowing their cancer to grow. This is because families are not being supplied sufficient means of paying for mammograms. According to Health Cost Helper in 2016, the uninsured mammogram costs on average $102. Cancer caught in later stages is far harder to treat, and the treatment is far less effective. The Cancer Research UK team in 2016 states that 90% of women diagnosed with cancer in the earliest stage survive their illness for at least 5 years, compared to the 15% of women diagnosed in the most advanced stage. Dr. Marissa Weiss in Mammography Benefits and Risks, What You Need to Know, states that women diagnosed in the earlier stages are far more likely to keep their breasts. Many of them are not being required to have double mastectomies or even a mastectomy, and their therapies are far less intensive. Women are losing their lives or portions of their lives to this deadly disease that could have been caught via mammogram. So let me tell you about how practical and crucial it is for insurance companies to start this coverage. Insurance companies should cover the cost of mammograms for women under 40. A mammogram is an x-ray taken of the breast using special equipment, usually done by an x-ray technologist under the supervision of a radiologist. It is a very simple procedure that takes place most commonly in hospitals. All insurance companies would be required to take on this new protocol. It would cover a yearly mammogram for women of all ages. The United States Public Health Services would be in charge of making sure that all the insurance companies are following this new protocol. It is very practical for both hospitals and the patients that they serve. It is a logical adaptation that would not take much adjusting and would take effect on January 1st, 2018. Many other medical expenses are covered by insurance. Surgeries, for example, are not paid for out of your pocket. Your insurance covers part and it counts towards your deductible. Mammograms would simply be added to this list of deductible items. The public would find this to be very desirable, as it greatly improves their health care as well as the health care of their loved ones. This change would help women to be diagnosed in earlier stages so that their cancer is easier to fight. In conclusion, insurance companies should cover the cost of mammograms for women under 40 years of age. First, I explained how cancer is a very serious illness that should not be taken lightly at any age. Then I explained how insurance companies covering the cost of mammograms would greatly improve patient outcomes. So insurance companies, that 25% of cancer patients is counting on you. Take a stand and start the coverage.